Om Swastiastu. Hello everyone, my name is Huliana Lim and I'm the representative of student group discussion B8 Ugrasena Medical School. In this occasion, we're going to present our student project with the given topic, lymphoma. And this is our group members. Now we will going to jump up to the background of this student project and will be presented by my peer. Thank you. Next.
Hello everyone, my name is Bagus. My number is 2025184. So today I'll talk about the backgrounds. So the lymphoma is originating from England in 1832. Hodgkin disease was proposed by Thomas Hodgkin for a patient with enlarged spleen and lymphadenopathy. Lymphoma is a solid tumor of the immune system found in the normal organs that can be seen with enlarged lymph nodes that are painless and generally attacks the external digestive tract and head and neck. These melanoma cells are characterized by multinucleate giant cells and cluster, referred to red stem cells or RS, known as Hodgkin cells, while non-Hodgkin is not found in the presence of Hodgkin stem cells. To treat cases of the lymphomas and non-Hodgkin lymphoma is to use methods such as chemotherapy and radiotherapy. According to Globocam, the case of non-Hodgkin lymphoma were around 5,000, and Hodgkin lymphoma approximately is 80,000, less than 80,000, were diagnosed with cancer, and 26,000 patients died in the same year. The last 30 years, the evidence of lymphoma cases is about 1.5 times more risky for males, and the average age and the incidence of non-Hodgkin lymphoma is around the age of 20 to 40 years. So the problem formulation of this student project is, the first one is, what is the definition of lymphoma, what is the etiology, epidemiology, and pathophysiology, what are the clinical motivations, how to diagnose and what is different diagnosed, how to treatment and the management available for the patients, and what a complication can occur with the patient, and the last one is, what is the prognosis of the lymphomas. So the objective of this student project is to know the definition of lymphoma, to understand the etiology of the risk factor and pathophysiology, to know the clinical manifestation of lymphoma, and to know how to diagnose and different diagnosis of lymphoma. The next one is to find out the right treatment or the management available of lymphoma sufferer, and to find out the complication that occur for patient in lymphoma, to know the prognosis of the lymphoma. So the benefit is that there's three ones. There's medical student one is the complete knowledge of lymphoma, starting from the etiology, epidemiology, risk factor, pathophysiology, clinical manifestation, prognosis, diagnosis, different diagnosis, as well as to find out the right treatment and the complication. The second one is scientific learning, that learn more about lymphoma and know how to treat it. The last one is community, that increase knowledge in the community who have a better understanding of lymphoma and the appropriate therapy for it. Next.
Hello, my name is Azza with registered student ID number 094. I will explain about the overview of lymphoma. Lymphoma is a hematological tumor defined by urban proliferation of T cell or B cells in lymphoid tissue or their progenitors. Lymphoma can start in any part of the body that contains lymphoid tissue. Lymphoma itself is divided into two groups. The first one is Hodgkin lymphoma, and the second one is non-Hodgkin lymphoma. About 90% of cases of lymphoma belong to non-Hodgkin lymphoma, while 10% of case lymphoma belong to the Hodgkin lymphoma group. Both Hodgkin lymphoma and non-Hodgkin lymphoma can occur in children, adolescents, and adults. Although the exact etiology of lymphoma is unknown, various correlations have been discovered, including the correlation of several type viruses, such as Epstein-Barr virus or EBV, human immunodeficiency virus or HAV, and human T-cell lymphotropic virus. In addition, ionizing radiation and family history are also associated with the cause of lymphoma. Symptoms that are most often found in people with lymphoma include swollen lymph nodes that are usually painless, neck sweats, fever, weight loss, and fatigue. Until recently, treatment of lymphoma involved one or more of chemotherapy, targeted therapy, radiation therapy, and surgery. That's all from me. Next slide.
Hello everyone, my name is Angelyne Mulia with last digit number 051. So next I will explain about the classifications of lymphoma. In general, lymphoma can be classified into two groups, namely Hodgkin and non-Hodgkin lymphoma. This classification is based on histopathological differences that can be seen from the presence of red stem cells in Hodgkin lymphoma. Hodgkin lymphoma is a lymphoid neoplasm that occurs frequently in young adults and less in elderly. It has a bimodal distribution with a peak incidence in young adults as well as in patients over 50 years. Some characteristics of Hodgkin lymphoma are almost specific among human malignancies, such as young age of onset, rarity of the presence of Hodgkin and red stem cells as malignant cells, and have a high cure rate. The classic form of Hodgkin lymphoma has 4 subtypes, such as lymphocyte-rich Hodgkin lymphoma, lymphocyte-depleted Hodgkin lymphoma, mixed cellular T-Hodgkin lymphoma, and nodular sclerosis Hodgkin lymphoma. Well, non-Hodgkin lymphoma is a malignancy that arises from the cells of the immune system, and its cells are closely related to normal lymph node cells, especially the cytology of normal lymphocytes. Non-Hodgkin lymphoma manifests predominantly like lymphadenopathy or solid tumors, and its classification is complex and continually evolving with more than 50 different subtypes. In general, non-Hodgkin lymphoma can be classified into low-grade or indolent and high-grade or aggressive lymphoma. In indolent lymphoma, the commonest type is follicular lymphoma, while in aggressive lymphoma, it is diffuse large B-cell lymphoma.
Thank you for the chance given to me. So now I would like to continue this presentation about the epidemiology of lymphoma. But before that, I would like to introduce myself. My name is Krishna Putra Pramanda. My student number 128. So now I would like to start from Hodgkin lymphoma. As we know, Hodgkin lymphoma could afflict persons of all age. However, it usually occurs in two age categories. The age distribution in Hodgkin lymphoma is classified as bimodal, with the first peak age being around 15 to 34 years, and the second peak age being more than or equal to 50 years. The subtype of nodular sclerosis is more prevalent in the young age group, whereas the subtype of mixed cellularity is more common in the old age. Next, I would like to tell you about the non-Hodgkin lymphoma. As stated by the most recent Global Count statistic, there are 509,600 NHL new cases that have been diagnosed worldwide in 3 years ago. The most prevalent NHL in Western nation is diffuse large B-cell lymphoma or DLBCL, B-cell lymphoma or BL with 2% of cases, and mantle cell lymphoma or MCL with 5% of cases, are two other aggressive B-cells. Follicular lymphoma or VL is the most prevalent sedentary indolent B-cells non-Hodgkin lymphoma in the Western world, accounting for 22% of cases, followed by marginal zone lymphoma or MZL around 8%, chronic lymphocytic leukemia or CLL around 6%, and lymphoplasmacytic lymphoma or LPL around 1%. That's all from me. This presentation will be continued by my friend. Thank you.
My name is Gede Raka Samudra, number 023. Now I will explain to you about the risk factors of lymphoma. The first one is age. People in the age groups either 15 to 40 or above 50 are often having lymphoma. Elderly patients with biologic characteristics such as expanded comorbidity, decreased tolerability, and more serious toxicity are worsening the prognosis. The second one is gender. Men are more likely to develop lymphoma than women because of surroundings factors and worksite disclosures resulting in lymphomagenesis. There are several factors such as the effect of sex hormones, genetics, and environment which have been involved in the prevalence. Compared to males' immune cells, females' immune cells have more substantive capability to control cellular pressure response through the defending mechanisms such as autophagy. The third one is family history. The possibility of developing lymphoma can be slightly higher when the person has parents, siblings, or kids who has had lymphoma. This is happened as an effect such minor inherited genetic changes. Besides all that, prior research shows that family history is about contradiction to lymphoma development presumably. That's all from me. Thank you.
Hello everybody, in this opportunity, I would like to explain the pathophysiology of lymphoma. First of all, let me introduce myself. My name is Putra and my student identification number is 20025111084. Okay, so let's start. There are several pathophysiology of lymphoma, both Hodgkin and non-Hodgkin lymphoma, but basically, lymphoma is characterized by the abnormal proliferation B or T cells in lymphoid tissue. So first is about Hodgkin lymphoma. There are several mechanisms, but I only explain two mechanisms. The first mechanism is telomeric alteration. We see in the first picture, a crippled GC B lymphocyte re-entering this region undergoes LMP1 oncoprotein induced transformation targeting the telomere shortening complex. NF-kappa B-driven mitosis leading to telomere shortening, resulting in telomere deprotection, and prone to undergo sister chromatin fusion, resulting in production Hodgkin cells and Ristenberg cell. The second mechanism is Hodgkin immune system evasion. If we see in the second feature, Hodgkin and Ristenberg cells express a high number of programmed L1 and programmed L2 molecules and they're suppressed, thereby paralyzing normal CD8 cytotoxicity and CD4 cytokine secretion. So tumor cells survive and develop progressively. The next is pathophysiology of non-Hodgkin lymphoma. Non-Hodgkin lymphoma arises either from B cells, T cells, or natural killer cells due to chromosomal translocation or mutation or deletion. Proto-oncogenes are activated by chromosomal translocation, and tumor suppressor genes are inactivated by chromosomal deletion or mutation. The translocation of chromosomal 14 and 18 is the most common chromosomal abnormality in a non-Hodgkin lymphoma.
Hello everyone, my name is Gloria with last 3-digit number 162, and I'm going to explain how to diagnose lymphoma. So the diagnosis of lymphoma involves history taking, physical examination, and laboratory tests. while taking medical history, fever, night sweats, chills, and involuntary weight loss of more than 10% of body weight might happen in some patients with late stage. In Hodgkin lymphoma, nodal enlargement usually appears in the supradiaphragmatic. Other common sites are in the left or right neck. The diagnostic tests used for lymphoma are biopsy, immunohistochemistry, flow cytometry, and diagnosis based on morphology. Excisional biopsy of an affected lymph nodes is the only way to make definite diagnosis of lymphoma. As an initial evaluation, fine needle aspiration and core needle biopsy might be carried out, but it is inadequate. And to find out the extent of the disease, PET CT could be done. Hodgkin lymphoma could be verified by identifying the malignant Reed-Sternberg cell, while non-Hodgkin lymphoma is characterized by nodular or diffuse histology patterns. That's all for me. The next slide will be presented by my friend. Thank you.
My name is Luh Wina Saraswati with the last 3 digits of student ID number 142. Now I will explain about the differential diagnosis of lymphoma. The first one is sarcoidosis. Sarcoidosis is a multi-system disease characterized by infiltration of several organs by non-necrotizing granulomas. More than 20% of patients with sarcoidosis have peripheral lymphadenopathy involving the cervical, axillary, inguinal, and epithelial glands. In sarcoidosis, the affected lymph nodes are swollen but painless. The second one is infectious mononucleosis. Infectious mononucleosis is primarily caused by the Epstein-Barr virus. Symptoms of infectious mononucleosis, known as glandular fever, usually appear after an incubation period of 4 until 7 weeks, including fever, lymphadenopathy, and pharyngitis. Infectious mononucleosis known to significantly increase the risk of Hodgkin lymphoma and multiple sclerosis. The third one is brucellosis. Brucellosis is a systemic disease that can affect any organ or tissue, especially the mononuclear phagocyte system. In some cases, extensive clinical polymorphism is also appear, leading to many misdiagnoses such as lymphoma and tuberculosis. In 10% until 20% of cases of brucellosis, lymphadenopathy is found, especially cervical lymph nodes being one of the most common sites of development. That's all from me. The presentation will be continued by my friend. Thank you.
Hello everyone, my name is Natasha Repusparani with a 3-digit number of 227, and here I'll be explaining about the management for lymphoma. So management of lymphoma differs between the two classifications, for Hodgkin and non-Hodgkin lymphoma. For Hodgkin lymphoma, choice of treatment is made by considering its histological features, the stage, and prognostic factors. In general, the initial treatment for Hodgkin lymphoma is divided into 3 subgroups. First, patients in the early stage with positive factors for prognosis are usually treated with chemotherapy, specifically 2 cycles of ABVD, or doxorubicin, bleomycin, vinblastine, and dacarbazine, with a short span. This treatment is preceded with a restricted involved field radiation therapy, or IFRT. Patients in the second subgroup, the limited stage disease with negative factors or prognosis, will have a longer treatment in terms of duration, usually up to 4 to 6 cycles of chemotherapy, continued with a higher dose of IFRT. Meanwhile, patients in the third subgroup, the advanced stage of this disease, will receive specific chemotherapy regimens. These regimens are determined by the International Prognostic Score, or IPS. For some cases, using escalated dose of biacop or bleomycin, etoposide, doxorubicin hydrochloride or adriamycin, cyclophosphamide, vincristine sulfate or oncofin, prednisolone, procarbazine will be implemented to this patient's regimen. However, the standard management is ABVD for majority of patients. For non-Hodgkin lymphoma, it has a variety of treatment options depending on the stage, its grade, high or low grade, existing symptoms, and histopathology. Commonly opted treatments include chemotherapy, radiotherapy, immunotherapy, chemoimmunotherapy, stem cell transplant, and in a few cases, surgery. So far, chemoimmunotherapy is the most common standard treatment option. More specifically, rituximab combined with chemotherapy. Usually for the early stage, radiation is a prioritized treatment. For stage 2, 3, and 4, it can be treated with immunotherapy and chemotherapy at the same time. Alternatively, targeted therapy and in several cases, radiation therapy may also be opted for later stages of non-Hodgkin lymphoma.
Good afternoon, Doctor. I'm Annisa Nuraini with the last 3 digits of 110. I would like to continue the presentation on the complications of Hodgkin and non-Hodgkin's lymphoma. So complications of Hodgkin and non-Hodgkin's lymphoma could come from the drugs and treatment used to treat patient. Mantle radiotherapy could cause cardiac disease such as pericarditis, coronary artery disease, and valvular heart disease. It is a fact that the largest cause of mortality in survivors is reported to be secondary malignancies post-treatment. Chronic respiratory impairment can happen due to radiation therapy and the use of bleomycin. Infectious complications can occur, but it depends on the prescribed chemotherapy, sex, and living conditions. Complications of non-Hodgkin's lymphoma may include febrile neutropenia, spinal cord or brain compression, and obstruction, also focal compression, depending on the location of the non-Hodgkin lymphoma. That's it from me. Thank you.
Good morning, afternoon, doctor. My name is Felix with last digit of Sutha ID 099. I will continue the presentation regarding the prognosis of lymphoma. So the prognosis of lymphoma, both Hodgkin lymphoma and non-Hodgkin lymphoma, has improved dramatically in the last 2 decades. The improvement of prognosis are caused by more effective staging of the disease and less toxic combination of the treatment. The prognosis of lymphoma depends on several prognosis factors, such as type, stage, clinical features, age, and many others. The stage of lymphoma is currently the most important factor in the prognosis factor. Hence, assessing the stage of lymphoma as soon as possible is crucial. So the most widely assessment are the International Prognostic Index and its variant. The International Prognostic Index is often used to group aggressive lymphoma patients into risk factors based on their prognostic score or factors. The lower the score, the better outcome are expected. The higher the score, the worse outcome are expected. So with the type of Hodgkin lymphoma, it has some of prognostic factors such as age, albumin, hemoglobin, lymphocyte count, stage, gender, and white blood cell count. If 0 to 2 factors are found in a patient, the cure rate of Hodgkin lymphoma is 75%. If there is 3 or more factors are found in the patient, the cure rate is expected 55%. So the prognosis of non-Hodgkin lymphoma is depend on the location of the histopathology and the patient factors, which the 5 years of survival is known to be 70%. Next.
Okay, thank you. Hello everyone, my name is Huliana Lim. My student ID number is 2002511080. Okay, in this occasion, I will going to present the conclusion of this study project. So basically, lymphoma is a solid tumor of the immune system that can be seen with painless and large lymph nodes. The specific cause of lymphoma is still unknown, but has association with several types of viruses such as EBV or Epstein-Barr virus. Lymphoma is classified into 2 groups, Hodgkin lymphoma and non-Hodgkin lymphoma, based on the presence of rich stem cell. The prevalence shows that male has higher risk since lymphoma is related to immune response of the gender is different. The diagnosis of lymphoma is based on medical history, physical examination, and diagnostic tests such as biopsy, immunohistochemistry, and flow cytometry. Differential diagnoses that must be compared are sarcoidosis, infection of mononucleosis, and brucellosis due to similar manifestation that lead to misdiagnosis. Treatment for Hodgkin lymphoma is made by its histologic features, the stage, and the prognosis factors. Treatment of NHL commonly includes chemotherapy, radiotherapy, and immunotherapy. The stage of lymphoma is currently the most important factors in the prognosis along with the type of lymphoma, the age of patient, and the clinical manifestation. Okay, I think that's it for the conclusion. And this is the bibliography of this project. Okay, I think this is the end of this presentation. Sorry if you have many mistakes. Thank you for your attention and see you next time. Om Santi 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 Om. Goodbye.